name is Pam Ritchey. I'm 46 years old. I currently live in Prescott Valley, Arizona. I've been happily married for 26 years. I have 2 daughters. I love the outdoors. I'm an avid skier.
My mom is super adventurous.
She likes to be in control of so many things in her life, and it seems like when she's on a set of skis, she likes to kind of push that envelope.
My mom had breast cancer at 44, so I've always tried to be pretty diligent about doing those self-breast exams. And I felt a lump, and it felt big, huge. And I was like, wow, this is definitely not normal. The radiologist went in immediately, and she did the ultrasound, and she said, you have a phyllodes tumor. When I got that diagnosis and my mom was there, it was really hard, because as her daughter and someone that watched her go through cancer and experience that with her and help her, the roles were being reversed, and now she's taking care of her daughter at the very same age. And it was gut-wrenchingly the hardest thing I've ever experienced, and we just cried and we hugged, and then it was like I had my moment, and then it was like, all right, so I can't change my diagnosis, but I can change what I do about it.
My name is Victoria Ashby Mitchell. I am a clinical sales rep for Stryker. One of my good friends, Pam, got diagnosed with breast cancer. We met for coffee, and I said, I'm sure this is more scary than I can even imagine, but I want to be there for you every step of the way. I was so honored to be considered part of her journey and to be able to help her through this process in any small way that I could.
My name is Molly Walsh. I am a plastic surgeon here in Phoenix, Arizona, with a large portion of my practice being breast reconstruction. I always was very happy when I knew Pam was going to be coming into the office. She has such a positive attitude.
The game plan was that we would remove that tumor. The surgery was performed and everything looked great. A week later, I get the phone call, and we were just sitting down to have breakfast, and she said, so unfortunately, your biopsy came back malignant.
Just kind of hits you like a ton of bricks, you know, kind of wonder what to expect, and you don't know, you know, it kind of turns your life upside down. When
you're diagnosed with breast cancer, I don't care how educated you are, how you think you're ready to receive the good or the bad. It's life-altering, and I can't imagine doing that alone. I am so blessed that my mom's still here with me, and so seeing my mom and being encouraged by that and seeing what a strong woman my mom is just amazing.
When a patient is faced with a diagnosis which will require them to consider breast reconstruction, it's really important for them to know their options.
Because as a woman, you're gonna look different. You question, like, are they gonna see me as weak? All those kind of negative things that go through your head, and then it's like, no, I'm not gonna accept that. I choose to not accept that. I needed to know that when I was making a life-altering decision of removing both my breasts, that I had that peace of mind. Nobody pressured me into it. Nobody said, you have to do this, but that I chose that path for myself. So many women, they're afraid to ask. They think that if they're asking, they're being pushy, or they're going against what physicians are recommending. And I wanna always convey, like, you have a voice, you have a purpose, and your purpose is to give you the best possible outcome you can have, because you did ask those hard questions. So I learned about the SPY technology through that conversation.
SPY technology has allowed us to look at the skin. It allows me to look at the blood flow, and I can make a more informed decision that allow us to have much better outcomes for our patients.
Don't you want the physician that is up with the latest technology, that's learning to utilize these techniques?
You have the power, you have the choice, and there are surgeons out there that are specially trained, that are educated in this, that can give a beautiful outcome.
That level of trust, that level of respect, that level of empathy. I had these great surgeons that I will always consider them family and my heroes. 2.5 months after my double mastectomy, I was up at the Grand Tetons skiing, my first run, and I tell you, there's nothing more gratifying.
To be able to know that my mom is sitting beside us and she's healthy is an amazing feeling.
Seeing Pam now, I just see this strong woman who looks amazing, who looks so healthy, who appreciates life, who is so active and outdoorsy, loves her family and so fiercely, and is now an advocate for other women going through the same thing.
And I've had the privilege of being part of several women's journeys right now who are actively going through breast cancer. I just felt like it is my job, it is my privilege to be part of that journey with them, because it's not just about me, it's about everybody you're connected with.